Okay, great.
Okay.
All right, good morning, everyone. Good morning. Today we're pleased to be able to have somebody to explain the medical program that we're going to offer you. And I know that a lot of you already have insurance, but there are some that don't. Is that better?
Yes.
Okay. So Todd is going to be discussing what we're going to offer. It's not a traditional plan per se, but it is a plan we think is very good for us and the workers that we have. And I'll let him take it away and explain it, and then we'll have a question and answer afterwards. And see if they've handed out the handouts already. So, Todd, it's up to you now.
Okay, thanks, Wayne. All right, so Wayne's right. This is not the traditional major medical where you think of like a bronze, a silver, a gold plan. In a major medical, you've got a large deductible usually. A lot of times a bronze plan sits right around $5,000. And it becomes a little bit tougher for a crowd making, let's just call it, an hourly crowd, to be able to really get the maximum benefit out of a major med. So you see that some of you probably have a major med today, and some of you might not. This plan was actually designed around the hourly workforce, and there's about 1,800 customers using it with about 800,000 people enrolled in the plan today. But this was designed to be what's called first dollar coverage, and it doesn't have a copay, it doesn't have a deductible, and it has a very low cost compared to the traditional major med. So some people will use this plan, and I'm going to bring all this up on the screen here in a second, but some people will use this plan in front of a high deductible major med plan as well. In that case, it's referred to as an uncoordinated wrap, because this is designed to be inside of that first $5,000. So that you get all of the benefit going to a doctor, filling prescriptions, going to an urgent care. You get all of those benefits inside that first $5,000. And if you were using a plan like this with a major med high deductible, the benefits that you took advantage of in a plan like this, you end up getting what's called an evidence of benefits. And that's given to the other carrier that you have a major med with, and it reduces the deductible by the amount you've already used. So there is value in using it in conjunction with a major med, but many people use this as their primary health insurance. And if folks do not have health insurance, you tend to use things like an emergency room as your primary way of getting care. And that isn't necessarily the best way to do it. Higher cost, a lot of wait time. So it's far better if you can go to a physician and actually get prescriptions filled and go to an urgent care. So that's what this has all been designed around. So when the Affordable Care Act first came out, there were two aspects of it that affected both the individual employee and also the employer. There's a thing called the individual mandate, and what it was designed to do is to actually penalize an employee that opted to do no insurance of any kind. So there is a product that's designed to take care of that penalty. It's called Minimum Essential Coverage, a MEC plan. Now, a Minimum Essential Coverage plan, and we're going to talk about that today as well. Minimum Essential Coverage is not health insurance, it's screening. There are 63 government required preventative screens that are built into a minimum essential coverage. So when an employee accepts a minimum essential coverage plan, they don't have the individual mandate. So I want to kind of talk about that mandate for a second, because the current administration decided to zero out the penalty for the individual mandate. So you as an employee, when you're filing your taxes, you are not getting hit with the almost $800 that you would have been in the previous years for not carrying at least minimum essential coverage. Now, for a business, for Visiting Angels, they still have a penalty for not offering at least minimum essential coverage. So what we do is we take this first dollar plan that I'm going to talk a lot more about right now, and we put it next to the minimum essential coverage that the government requires companies like Wayne's, like Visiting Angels, that have 50 or more full-time or full-time equivalent employees. He has to at least offer that plan. Now, that doesn't mean that you all have to accept it. So when we sat down and had a good conversation about benefit strategy overall in general, we talked about what benefits that could actually be used and effective by the employee versus what would help handling some of the tax related issue. And what Wayne and his group have decided to do is to subsidize a portion of the benefit that actually is usable that lets somebody go to a doctor, fill prescriptions, go to an urgent care. So we're going to be talking about two different plans that are going to be presented to the caregiver audience. One of them is more usable. The other one is mandated. You're welcome to accept whatever plan you want or none at all. Just by making the offer of that minimum essential coverage, that really takes care of some of that tax issue. So he's got it there. We're offering it out. It's not required that anyone take it. It's required that it be offered. Okay, so that's just a little bit of background. Now, if the individual mandate gets reinstated,
if I can,
yeah.
Are you showing anything on your screen? Because
you
don't show it.
I hadn't yet. I was just about to show it right now, but because it was really going to be the price points of this one, so I wanted to make sure I gave a little background before I dove into the visuals. So
okay, we got it now.
Okay, no, but thank you, Wayne. I mean, you're right. If I was supposed to be showing something and I wasn't, that's always a bummer. So I'm going to start out by talking about this first dollar coverage. It's called a fixed indemnity. A fixed indemnity, like I said, it doesn't have a copay. It doesn't have a deductible. It has a defined list of benefits that you can take advantage of. Now, this is a part of First Health. That's the network. So you as a caregiver, when you're trying to decide, hey, where am I going to go to get taken care of? It's the First Health network. And I'm going to show you how you access the First Health network. But it's the second largest in the US, and it's everywhere. I mean, it's in Hawaii, it's in Alaska, it's in New York, it's everywhere. And what's nice about that is before I take a trip, I'll go ahead and look up the zip code of the area I'm visiting and just have a heads up of what urgent cares at least are in the area, that if something happens to me or my family, if you want to enroll your family, you have that as an option as well. I will say, though, that the subsidizing that Wayne is looking at doing is really for you as the caregiver. So when he talks about an amount, it's you. If you decide to add other features to this, like the family, or there's also ancillary products like dental and vision, those things are separate, but they're available if you want to add them, if you need to add them. But the primary thing that he and the group were looking to do is to bring something to you as a caregiver. So he's trying to take care of a portion of that. So in it is the second largest network. Like I said, no deductible and no copays. It is first dollar coverage. You get an insurance card. Some people ask me, is this one of those plans like, let's say, an Aflac or something like that, where I would go out to the emergency room and I'd pay the bill and then I'd come back and I'd send it off to Aflac and they would reimburse me at a later date? No, it's not, for two reasons. It's not a reimbursement plan. This is paid most of the time directly from the provider to the physician or whoever it is where you got the service. You've got an insurance card. You present the card when you go to the doctor or the urgent care. They look up the plan. They know exactly what benefit they're getting. But as an example, the plan that we're going to go over here, when you look at like a physician's office visit right here, this has a benefit of $100. What does that mean? If I'm going to see a doctor and I'm outside Mentor, Ohio, and let's say the visit is $85. The carrier pays that physician $85 directly, and the other $15 of the benefit gets paid to me as the caregiver because it is a defined $100 benefit. So you don't have a copay, you don't have a deductible. Well, let's go the other direction. Let's say that you were down in Cincinnati and you needed to go see a doctor. And let's say it's a little bit more expensive area and it was $110 for that office visit. You went to a doctor that was in the network or an urgent care that was in the network. The carrier pays the $100, but the doctor knows that's what they're receiving. So you're going to be paying then and there $10 because it's a defined benefit of $100. So that's the overall concept behind this. I'm going to want you all to look through these different benefits and see exactly what you can get out of this. Now, the cost of this was designed around the hourly crowd. It's one of the unique aspects of the product's called Flexible Staff Care. One of the unique aspects of it is it was designed around hourly. So we do talk about numbers in an hourly way, but you also see the monthly in there as well. Now, Wayne is going to subsidize a portion of the employee only for those that are working full-time hours, which are really going to, in this case, be 30 hours or more in a week. He's planning on subsidizing half of the cost of this. So you'll want to think about the hours that you're working, and when you make a decision on whether or not you want to take advantage of a product like this, are you going to keep working those hours? Are you going to work more hours, less hours? You're going to want to give some thoughts to that. So this is the fixed indemnity, which is the plan that we really want you to take the deeper dive look at. We're also going to talk a little bit about some of the ancillary products. So these are getting into dental, vision, hearing, and term life. They're brought to you as a package. So unfortunately, you can't say, oh, I only want vision. It's brought to you as a package. That's the way that our carrier deals with the state of Ohio. There are some differences state by state, but take a look at these and see if you see value in these. And this is also in the handout. And then you'll see what the cost is. And again, it's $34 on the month. It's roughly $8 on the week. And you do have to actually take advantage of the fixed indemnity to actually take advantage of the ancillary. It's an add-on. It's not, you can just pick ancillary by itself. Now, I want to show you a little bit of that other product that Wayne has to offer because of the Affordable Care Act. It's called minimum essential coverage. Now, why would a MEC plan have been valuable to you? This would have gotten you out of the individual mandate. So a lot of times in the past, as soon as the Affordable Care Act kicked in, you started seeing these minimum essential coverage plans all over the place from employers. And an employee might say, hey, I have no insurance, and I'm going to get hit with this roughly $800 penalty when I'm filing my taxes. I might as well take this, even though it's not health insurance. It does have screenings, 63 different screens that I could go out and get done. I might as well get something for my money. Now, because that individual mandate is zeroed out for you, you don't have the penalty. If you still want to take advantage of it, you certainly can. It's not a terribly expensive program because it's not health insurance, it's screenings. So it ends up being roughly $60 a month. So this is more of a requirement that we make an offer of it than it is for you to actually take advantage of it. So this is the handout I believe that Wayne has given you all. The one I really want you to focus in on is the fixed indemnity, just because it is health insurance. It doesn't cover major medical. If you got into a car accident or something else happened to you, you could use the benefit until it ran out. You'll notice that if you're inpatient hospital, you still can get a surgery. It's just that a major medical incident oftentimes runs quite a bit higher than the things that happen in that first 5,000. So it would pay up until it stopped, and then the bill would go on from there. Before I head over to some questions, I wanted to show you something real quick. Okay, so how do I know if I decided to take advantage of this program? How do I know where to go? So if you go to this First Health, where I'm going to go to the home real quick, it's actually FIRST, firsthealth.com. And then from there, there's a button over here on the right that says locate a provider or create a directory. Now, this information is also in the enrollment platform as well, but I wanted to show you how to do this. Pick the First Health network. Hit start now. And then you can decide where you want to search up. First off, do you want to find a physician? Are you looking for an urgent care? Do you want to see all providers? And then what is the, let's see, what's the zip code for Mentor? Anyone?
It's 44060, John.
4060. So I did a 10-mile radius, show me all providers. So if I look at all providers, it's going to be a fairly large number for all providers. There's over 1,000 matches. Now, you can change that, and you can say, I'm looking for a physician, I'm looking for a pediatric doctor that's accepting new patients. That you can make a change to this and whittle it down. But that's a lot. So I turned around and said, you know what? One of the very first things that I want people to look into is urgent cares. You don't want to go to the emergency room unless it's actually an emergency. In my area, I'm in Denver, Colorado, and in my area, these doc-in-a-box concepts started popping up all over the place, but they are actual ERs. People thought they were urgent cares, and they were using them like an urgent care, and then they were getting a $6,000, a $10,000, a $12,000 bill for a scratch or a bruise or a cut, and they were like, oh my goodness, and it's because it's a full ER. So I want to know, and the state of Colorado actually passed a law that said they have to tell you when you walk in that you're walking into an ER, not an urgent care, and give you examples of the difference in price. So it was so bad out here that they actually passed a law. But if I go in here and say, give me the urgent cares, let's see what comes up within a 10-mile radius. So we've got 6. So Lake Mentor, or Lake Health Mentor, healthcare clinic at Select Walgreens. So, I mean, at least I know within a pretty short drive who's in network for me. I mean, half a mile away from that. I mean, that's pretty good. So that's how you would all figure out, you know, where can I take advantage of this? And it's also the Caremark system, which is for prescriptions, which is CVS. That's a pretty good one. I use it as well. So CVSs are pretty much everywhere, but Caremark, you can also look up on Caremark's website for the prescriptions that you can hit very easily. So that's an overview of what happened with the Affordable Care Act. Why does Visiting Angels need to bring a product like the minimum essential coverage to you? Why they want to bring you a product that's usable benefits at a low cost and subsidize a portion of it. So are there any questions that you all have?
If you have a question, raise your hand and I'll relay it. The question, Todd, was about full-time work, and I'll answer that. If you are working 30 hours or more, we will pay half of the individual premium, okay? If you're not working full-time, you can still opt into the program. You'll just pay the full cost.
What do you mean by that? The 112, you pay the half of that?
Right, every month. Right, or every, you know, the pay period's bi-weekly, so it's essentially, you know, we'll be paying $26. You'll be paying, you know, $52. We'll be paying $26. No, the open enrollment actually starts in mid-November, so we'll be getting information out to you about that, you know, and how to go about doing it. Today is more informational about the, you know, the program itself. Mike? People on Medicare? Todd, the question is, what about folks on Medicare?
So if somebody is on Medicare, you can still use a product like this for your day to day. So you would want to go back and look at what level of Medicare are you taking advantage of? Do you still have upfront costs before Medicare kicks in? Because it's similar to a traditional major med plan. You can use a product like this in front of a major med plan, but I would probably look at, I mean, people buy up into Medicare to the point where it's a really solid plan and you have very, very limited costs on the upfront side in some cases. So I would look into what your own cost structure is on whatever plan that you're carrying, Medicare included, and see if there would be benefit.
Mike?
You use the dental vision on top of your own dental vision plan?
The question, Todd, is can you use the dental and vision plan on top of a plan that you may have already purchased?
That I do not know. That's a very good question. Most of the time people look at the ancillaries when they do not have a dental plan, a vision plan. So I know that the way insurance in general works is you can't basically double dip, right? You can't bill two providers for the same service. So if a provider has a level of service and you take advantage of it, but then the bill goes above it, then another provider can step in to take that, but you're not able to turn in the same bill for two different plans and basically double dip. So you'd have to look at how the plan works, where they look at your cost and then look at how this plan works. I don't know enough about other ancillary dental vision type plans, but I mean, I know that in a life insurance example, you can have multiple life insurance policies and still be able to take advantage of it. So it'd be the fine points of looking at what do they consider what are they covering? What are they asking you to cover? And then you put this in front of it and say, if I had this covering this section and this covering this section, does that mean I'm totally covered? So you just got to make sure that you're not crossing over getting the same exact benefit. They won't let you do that.
Yes.
Can a non-employee get insurance benefit with it?
No. No. The question was, can a non-employee purchase this insurance? And
they cannot. This is a group plan. So you if you were no longer an employee, but you had done it while you were with Visiting Angels, the option of COBRA does exist, but that's only if Visiting Angels decides to include the COBRA piece of it. And that would mean somebody started under group and then they have the 18-month run of paying it directly to the carrier themselves with no involvement whatsoever from Visiting Angels. But you had to start as an employee when you took this. It's not an individual plan.
Yeah. You can keep it for what, up to 18 months after you leave?
And it's actually a fairly inexpensive COBRA model. In a lot of major med COBRA situations, the cost is excessive. This one only is about roughly 3% more than what the bill is as a group health plan. So it's not bad. And it could be beneficial if you were working with Wayne's group, you needed to take a hiatus for a period of time, but you really planned on coming back. That might be a pretty cool reason to do it. Or just, I mean, the benefit is pretty solid. So as long as Visiting Angels is planning on the COBRA option, then it's there.
Yes, go ahead.
With this term life, that's included with the benefits?
Yeah, the term life, it's a $20,000 term life policy that's included with the dental and vision benefit. Yeah.
Yeah, the ancillaries, the dental, the vision, the term life is a bundle. That all comes as one offering.
And that's for as long as they work for us, right? I mean, there's no limit on age or anything, right, Tom?
That's correct. There is no limit on age or anything. It's as long as you are getting a deduction on this, you can take advantage of this. That's correct. These are
Other
payroll
questions?
deductions.
Yeah, you probably have an answer in there. So where it says like a physician office and going on down where it says maximum per benefit period 8 days. So that means in that paid benefit period, you can only see the physician for 8 days and they'll give you that 100. Anything after that?
The question, Todd, is for seeing a physician, like the benefit, it says it's for 8 days. Can you explain that further?
No, I think your caregiver read that exactly right. So during the cycle, during the year, you would get a max of 8 physician office visits inside the plan. That's absolutely correct. Now, when there are some really specific questions, we have an 800 number, and you can call in with as many examples as you need. So there is a full staff there to answer very specific questions as well.
Go ahead. The question is, could that benefit be used for primary or a specialist?
It can, yeah. This is not
Any
a
other questions?
HMO concept where you have to get a referral from a primary to see a specialist or secondary. It's not like that. So you get the benefit when you're going to that doctor, period.
Okay, I don't think there are any more questions, Todd. Thank you so much.
Absolutely. Thank you, everyone. And hopefully the in-service continues going off well. And this is recorded. Wayne, I'll share it for you for the Saturday session. And you all have a great day back there in Ohio.
Thanks, Todd. Okay, so just to follow up,